Hi, I'm Dr Frankie Swords, Medical Director of the Norfolk and Waveney Integrated Care Board. Across Norfolk and Waveney, allied health professionals are the third largest clinical workforce, and it's vital that AHPs have a voice that is heard, that they feel represented throughout our ICS, and that they play key roles in how we plan new services and solutions for the future. So I'm delighted that the AHP Council and the AHP faculty will be embedded in the future architecture of our ICS. We hope that the Council and faculty will provide a dedicated platform for AHPs to come together and help deliver the ICS strategy, the people plan and the AHP workforce plan, which is being launched this week.
Across Norfolk and Waveney there are over 800 allied health professionals, more than 200 support workers working in acute trusts, the community, mental health services, county council and our colleagues in the private sector. Allied health professionals have the knowledge and the skill to lead on clinical pathway redesign, workforce transformation, developing services for our future population of Norfolk and Waveney.
999 mode activated.
I work for the East of England Ambulance Service as an advanced paramedic in urgent care. This role involves working on emergency ambulances and as a solo clinician on rapid response vehicles. Additional training has led to an increased range of urgent care skills, experience and range of medications I can administer to patients. The main idea of this role is to deliver urgent care in the community where appropriate rather than admission to hospital.
There's 3 OTs currently in West Norfolk and we cover the West Norfolk area. We work jointly with the physiotherapists who are also in our team, and then we also go out and do visits with nurses or speech and language therapists. Then we also work across the Roxburgh Children's Centre, and in there we have again nurses and we have also play therapists who we sometimes will liaise with to help us bring their play into our sessions so we can get the most out of the child. If they're cerebral palsy and they have a hemiplegia, so their affected side is not working as well, and we're trying to get them to use the affected side and they're not cooperating with us, we might get the play therapist involved and see if she can come up with new ways to help us get the outcome that we want from the child.
The intensive treatment team is a team set up to support young people diagnosed with an eating disorder under the age of 18 in Norfolk and Waveney. We are here to provide intensive support for those young people with their condition around meal support, family therapy, education, and provide a balance to get them back into home life as soon as possible.
We have been expanding our research in line with the Trust research strategy and looking to get more AHPs involved in research and increase our AHP portfolio. For a number of years we've been increasing our portfolio within imaging, and we're now looking to increase research across all of the AHPs and specialities.
My clinical background is as a podiatrist, and over the last 5 to 6 years the Trust has supported me to complete an NIHR funded PhD. I completed my PhD earlier in the summer. I'm now working with the Trust to develop clinical academic careers for nurses and AHPs with a consultancy role focusing on research. This will give me the opportunity to further the research I started as my PhD and support colleagues in nursing and AHPs who want to begin a research career in the Trust.
The availability of an ODP apprenticeship for theatres has been really important for us being able to secure our workforce for the future. It's also given staff who potentially would never have considered perhaps going on to degree level study the opportunity to be able to do that based on their experience that they've got in their previous role here in the department. So it's kind of securing our workforce as well, which has been great for us as a department, and it's opened so many doors for the staff to develop, for us to be able to ensure that we've got the appropriate numbers for our workforce in the future, and also potential development opportunities for the development of the Trust, especially with potentially getting a new hospital as well in the future.
I think it's important to recognise that AHPs generally have extraordinary capabilities within all parts of healthcare, and with diagnostic radiographers being AHPs, one of the other principles we've got is to make sure that they work to their top of licence with full autonomy, and the hope therefore in a dedicated environment with that type of approach to their daily their daily work will be that they leave feeling that they've had a fulfilling and rewarding day.